they're just baby teeth. Do we have to fix them? So it is true that they are just baby teeth. However, baby teeth have a lot of purpose that they serve. One, obviously, it's for speech and chewing and function when they're growing, but a lot of the baby back teeth especially actually serve as a guide for how the permanent teeth will come in. If you actually lose a baby tooth really early on and the adjacent teeth shift, spacing could be a concern later on, like permanent teeth could be blocked out because things kind of shifted forward. But the most importantly, if you get a cavity in a baby tooth, at the beginning stage, it might not be as big of a concern because it's just a small cavity, but if you leave it long enough, there's chances that they could cause pain, they could cause infection. And eventually, if the infection gets big enough, if we have an abscess or we could have fever, the infection could actually drain downwards towards the permanent tooth, and that becomes a bigger concern because now the infection not only is impacting baby teeth, it could actually potentially impact permanent teeth as well. And kids sometimes are really resilient. They don't really like to talk about them being in pain, but if they do have baby teeth that have a pretty big cavity, they could be in pain throughout the day without us really being aware of it, and that could really affect their day-to-day. If a tooth is already loose, it has a cavity, I usually say, let's wiggle out at home. There's no need to do a whole thing in the office, but if it's something that's going to stick around for 5-6 years, it's really important to address it so we don't have to go through the process of traumatic experience and having to do extensive dental work. It's much easier to prevent to get to that point.